Hi, it's Dr. Dan Joseph, and I thought I'd take a few minutes today and discuss knee pain, specifically arthritic knees. The story goes like this. When knees start to hurt, they don't get better. They just continue to get worse and worse and worse. It's almost like the tread on a tire. It wears out. The longer you use it, when it becomes a problem, it just gets worse and worse. It doesn't get better on its own. So what do most people do? It starts to hurt, they ice it, and then as time goes on, they start taking Advil. Then they go to the doctor and they ask for an arthritic medication. Then they get cortisone injections, which are temporary and have side effects. Sometimes they do these gel shots, and ultimately it's a long, slow process that leads you to surgery, right? So there are alternatives to that. But before we discuss those, you need to understand what happens. Your knee is set up like this. Up here is your thigh bone, called your femur. Down here is your shin bone, called your tibia, okay? Right here in between, I wish you could feel this, but it's kind of rubber. It is rubber on the model, but in your body, that's where the cartilage and the meniscus live. As we get older, as we wear down, as we have problems, what happens is that cartilage and the meniscus, as you can see, starts to wear out where all that red is. That hurts. That hurts when you go down steps. That hurts when you go up steps. It's very painful. That's called degeneration. The orthopedics have classified 4 stages a knee goes through in response to arthritis. Stage 1, 2, 3, 4, with each stage getting worse and worse and worse. Once you get to stage 4, the only thing that can be done is surgery. So we need to see you before stage 4. And that's where our regenerative medicine department comes in very, very successfully if you're a candidate. And finding out if you might be a candidate is as easy as a simple x-ray. And that will tell us which stage of arthritis you may or may not be in.